In today's video, we explore 30 registered behavior therapists, also known as RBT, interview questions you will be asked during your interview. Each answer can be customized to highlight your unique qualifications and experiences. Before your interview, it's important to research the company and review the job description so you can incorporate key skills relevant to the job role in your answers. Let's explore some general registered behavior technician interview questions. Question number 1. What are your main strengths? Hiring managers want to know if your strengths align with the demands of the RBT role, like patience, consistency, and communication. They're listening for qualities that help build trust with clients, support BCBAs, and follow behavior plans effectively. This question helps them see how self-aware and reliable you are. I'd say my main strengths are patience, consistency, and clear communication. Working one-on-one with clients, especially children with autism, requires a lot of calm, steady energy. I've learned how to stay composed in challenging moments and give praise and redirection in a way that feels supportive instead of overwhelming. I'm known to follow behavior intervention plans closely and communicate regularly with the supervising BCBA if I notice any patterns or concerns. One strength I've developed is staying present, really observing behaviors, not rushing, and making the most of each session. That makes a difference in how well the client responds. I also build strong relationships with both the clients and their families. I take time to learn what motivates each client, whether it's praise, a toy, or a simple high five. Those small connections help build trust, and trust is the foundation for progress in this kind of work. Question number 2. What are your main weaknesses? This question helps hiring managers see how honest and reflective you are. It also shows whether you're aware of the emotional demands of being an RBT. They don't expect perfection. They want to know you're open to growth and won't let a weakness affect client care. One of my weaknesses has been taking it personally when I don't see quick progress with a client. I care deeply about the families and kids I work with, so when it feels like we're stuck or not getting results, it can be discouraging. Early on, I used to feel like I was doing something wrong. But over time and with support from my BCBA, I've learned to focus more on consistency and small wins. I remind myself that progress doesn't always look the same for every client, and part of my job is just showing up and being steady. Now I try to celebrate things like increased eye contact or reduced maladaptive behaviors. Even if they're minor, it's helped shift my mindset from frustration to patience. I'm still working on it, but I've gotten better at trusting the process and not putting unnecessary pressure on myself or the client. Question number 3. What was your most and least favorite thing regarding your previous role? Hiring managers ask this to learn what motivates you and what you find challenging. It also shows whether you have a realistic view of the RBT role, which can involve both rewarding and repetitive tasks. They want someone who enjoys the core responsibilities, but can also manage the tougher parts with professionalism. My favorite part of my last role was seeing clients make progress even in the smallest ways. Whether it was a child pointing to a preferred toy for the first time or using words instead of behaviors, those moments made everything worth it. I also enjoyed building trust with families and feeling like I was part of something meaningful. The least favorite part was data collection during really challenging behaviors. It could be tough to stay focused on recording everything while still managing the situation in real time. I understand how important accurate data is, so I always did my best, but there were days when it felt overwhelming. To improve that, I started prepping my materials more efficiently and used strategies to keep the client engaged between trials. That helped me balance safety, engagement, and data collection better. I wouldn't say I loved that part of the job, but I learned how to manage it in a way that didn't take away from my overall experience. Question number 4. Where do you see yourself in 5 years' time? Hiring managers want to know if you're committed to the field and thinking about your long-term growth. It's also a chance for them to see whether you might be interested in becoming a BCBA trainer or taking on leadership roles. Your answer tells them if you're serious about making a career out of behavior therapy. In 5 years, I'd like to be working toward becoming a board-certified behavior analyst. I've grown to really love the science behind behavior and how impactful this work is, not just for the clients, but for their whole families. Right now, I'm focused on being the best RBT I can be, but I definitely see myself pursuing more education and certifications to move into a BCBA role down the line. I want to gain more experience across different settings, homes, clinics, schools, and learn how to adjust interventions based on the environment. I also enjoy helping newer RBTs feel more confident, so I could see myself taking on a mentorship role one day. Whether I'm still working directly with clients or helping design programs as a BCBA, I know I want to stay in this field. It's a job that feels meaningful, and there's always more to learn. Question number 5. Why are you interested in this role? Hiring managers ask this to see if you understand the responsibilities of an RBT and whether your motivation goes beyond just needing a job. They want to know if you're passionate about working with individuals with autism or behavioral challenges and if you're committed to helping others grow. Your answer should reflect emotional connection, awareness of the role, and long-term interest in the field. I'm interested in this role because I genuinely care about helping others grow and feel supported, especially children who need extra patience and structure. I've always been drawn to work that involves making a real difference in someone's life, and once I learned more about applied behavior analysis, it just clicked. The idea of using positive reinforcement and structured techniques to help someone gain independence is something I find really powerful. I also enjoy working in one-on-one or small group settings where I can build relationships and see progress over time. I've seen firsthand how important consistency and compassion are in this kind of work, and that's something I bring to every session. This role allows me to combine my interest in psychology with my desire to do hands-on, meaningful work. I'm excited to grow in the field, learn from experienced BCBAs, and give clients the steady support they need to thrive. Question number 6. How did you hear about our company and about the job opening? This question helps hiring managers understand how you're finding roles and whether you've taken the time to research the company. It's a way to gauge your interest level and see if you're applying thoughtfully or just sending out applications broadly. A thoughtful answer shows initiative. I heard about your company through a colleague who works in the field and mentioned you have a great reputation for supporting both clients and staff. That made me curious, so I did some research on your website and also read reviews from current employees. I noticed that your team places a lot of emphasis on collaboration and growth, which really stood out to me. I also appreciated that you work with a wide age range and offer opportunities to specialize in different areas over time. I saw the job posting on Indeed, but it was the way your company described the role, focusing on consistency, compassion, and professionalism that made me want to apply. I'm not just looking for a job, I'm looking for the right fit where I can stay long-term, keep learning, and be part of a strong, client-focused team. Everything I've learned about your company makes me feel like this could be that kind of place. Question number 7. What are your expectations regarding your salary? Hiring managers ask this to make sure your salary expectations match their budget and to see how informed you are about pay in the field. They also want to know if you're flexible and open to discussion. Being realistic and confident while showing you value the full opportunity is important. I understand that salary can vary depending on experience and location, and based on the market and similar RBT roles in this area, I'm looking for something in the range of $25 to $35 per hour. I believe that's fair given the responsibilities of the role and my commitment to bringing consistent, high-quality care to each client. That said, I'm also interested in the full picture. Things like supervision quality, training support, and opportunities to grow within the company are just as important to me. I want to be in an environment where I can develop my skills, stay long-term, and contribute to a strong team. If the role is a great fit, I'm open to a conversation about compensation and trust that we can find something that works for both sides. Question number 8. Why do you think you are the right person for this job? This question helps hiring managers understand how well you know the job and if your skills, attitude, and values line up with what they need. They want someone who is reliable, compassionate, and committed to the daily work it takes to support clients. A strong answer shows confidence and understanding of the demands of the role. I believe I'm the right person for this job because I have the patience, consistency, and work ethic needed to support clients through all kinds of challenges. I don't get discouraged easily, and I'm the type of person who shows up on time, prepared, and ready to adapt if something doesn't go as planned. I've worked with kids who had difficulty communicating or regulating emotions, and I've learned how to stay calm and supportive even when things get tough. I also follow routines carefully, document progress accurately, and always check in with the team if something seems off. What motivates me is knowing that even small progress, like a child saying their first word or completing a task independently, is a big deal. I want to be part of that journey. This job takes more than just showing up. It takes consistency, empathy, and a genuine belief that every person can grow. That's how I approach the work every day, and I'd be proud to bring that mindset to your team. Here are some registered behavioral technician interview questions based on your background and experience. Question number 1. What qualifications do you have to become a registered behavioral technician? Hiring managers ask this to confirm that you meet the formal requirements for the role, including training and certification. They also want to hear that you understand what the position entails and are ready to support clients under the supervision of a BCBA. Your answer shows how prepared and committed you are to working with individuals with developmental or behavioral needs. I completed my 40-hour RBT training through an approved provider and passed the competency assessment under a licensed BCBA. Once I met those requirements, I passed the RBT exam and have been maintaining my certification through continuing education and supervision hours. I also have a background in psychology, which helped me understand behavior principles even before starting formal training. I've been trained in data collection, implementing behavior intervention plans, and understanding the importance of ethical standards in this field. I stay current with the BACB guidelines and make sure I'm always aligning with best practices. Beyond the technical qualifications, I think having patience, empathy, and a calm presence is just as important. I'm someone who really listens to clients and takes time to understand what each individual needs. Being qualified on paper matters, but how you show up for people each day is just as critical. Question number 2. What experience do you have working as a behavioral technician? This helps hiring managers gauge how familiar you are with the day-to-day responsibilities of the job. They want to know what kinds of clients you've worked with, what settings you've been in, and how comfortable you are with behavior plans and data tracking. Your experience helps them see how quickly you'll be able to adapt to their program. If you don't have direct experience, they want to see if you have transferable skills, a clear understanding of the role, and a genuine interest in working with individuals with autism or developmental differences. If you have previous experience working as registered behavior technician, you can use the following answer in your interview. I've worked as an RBT for about 2 years in both clinic and home-based settings, mostly with children diagnosed with autism spectrum disorder. I've supported clients across different age groups, but most of my work has been with preschoolers and early elementary age kids. I'm comfortable running skill acquisition programs, collecting data in real time, and helping manage behaviors using BCBA-designed intervention plans. One of my most rewarding cases involved a nonverbal child who made progress using PECS. I helped run sessions that encouraged communication through pictures and reinforced small successes with consistent praise. It was amazing to see his confidence grow over time. Each client is different, so I've learned to adjust my tone, energy level, and pace based on what the child responds to. I also stay in close contact with the supervising BCBA and parents to make sure we're aligned. That collaboration really helps the progress stick. Next, here's a perfect answer for someone with limited experience as a registered behavior technician. While I haven't worked as a registered behavior technician yet, I've done a lot to prepare myself for the role. I recently completed the 40-hour RBT training course and found it really engaging, especially learning about reinforcement strategies and how to track behavior data. I also have experience working with children through volunteer programs at a community center and babysitting regularly for a family with a child who has ADHD. That gave me some real insight into being patient, consistent, and staying calm in unexpected situations. What draws me to this work is the opportunity to help someone grow, step by step. I know this role requires focus, empathy, and the ability to follow treatment plans closely, and I'm ready to take that on. I'm a fast learner, detail-oriented, and open to feedback, which I know are important for success in this field. I'm excited to learn from experienced BCBAs and start making a positive difference in the lives of clients and their families. Question number 3. What have you done in the last year to improve your behavioral technician skills? This shows whether you're committed to ongoing growth and keeping up with best practices. The field of ABA is always evolving, so hiring managers want to see that you're not just meeting the minimum, but making the effort to improve. It also tells them how self-motivated and teachable you are. Over the last year, I've focused on improving my skills in data accuracy and functional communication training. I started by asking my supervising BCBA for feedback on my session notes, and she helped me tighten up how I recorded and interpreted behaviors. I also took a continuing education course on behavior functions and replacement strategies, which really helped me feel more confident during sessions. One of the biggest changes I've made is how I respond to challenging behavior. I've become more proactive by identifying early warning signs and adjusting the environment to reduce triggers. I also started following a few well-known BCBAs online who share research-backed techniques, and I've picked up tips I now use regularly, like how to reinforce desired behaviors without overprompting. For me, improving is about small, consistent steps. I want to give every client the best support I can, and I know that starts with being open to learning. Question number 4. Did you ever have a moment when you were overwhelmed by a heavy workload? This question helps hiring managers understand how you handle stress, which is a big part of being an RBT. The work can be physically and emotionally demanding, so they want to know if you have coping strategies and how you stay professional during tough moments. They're also checking if you're honest about challenges and open to seeking support. There was a point when I was juggling a full client load while covering extra hours for a teammate who was out. I wanted to help, but I started feeling worn down and noticed it was harder to stay focused during sessions. I didn't want that to affect the kids I was working with, so I spoke with my supervisor about adjusting my schedule slightly. She helped me build in some time for breaks and better pacing between sessions. I also started prepping my materials the night before and keeping a short checklist to stay on track without getting overwhelmed. What I learned is that taking care of myself is part of taking care of others. It's not about doing less, it's about working smarter and knowing when to ask for help. That's made me a more balanced and effective RBT. Question number 5. Can you tell us about your professional relationship with your previous colleagues? Teamwork is essential in behavioral therapy, especially since RBTs often collaborate with BCBAs, families, and other staff. This question shows how well you communicate, take direction, and contribute to a positive work environment. They want to know that you'll be respectful, dependable, and easy to work with. I've always had strong relationships with my coworkers, especially the BCBAs I've worked under. I make it a point to ask questions when I need clarity, give honest updates about client progress, and show up consistently for team meetings. I think mutual respect and open communication make a huge difference in this field. There was one case where a coworker and I had different approaches to working with a client. Instead of letting it build tension, we talked it out and found a middle ground that kept the client's needs at the center. That conversation helped both of us grow. I also make an effort to support new RBTs by sharing tips that helped me early on. I've learned that being part of a strong team doesn't mean you always agree. It means you stay focused on the client and work together toward the same goal. That's the kind of culture I hope to bring wherever I work. Before we continue, I just want to take a moment to thank you for watching this video. You can download a copy of these interview questions and answers in PDF format by clicking on the link below and supporting my channel by making a minimum donation of $3. Your support allows me to keep creating valuable content to help you pass your interview and land your dream job. Thanks for your support and appreciation. Question number 6. Are you more experienced in working alone or within teams? This question helps hiring managers understand how you function in different environments. RBTs often work one-on-one with clients, but they're also part of a larger support team that includes BCBAs, teachers, and sometimes family members. They want to see if you're flexible, communicative, and able to collaborate while still being independent and reliable when needed. I've worked in both situations, but I'd say I'm most comfortable in a team setting while still being confident working independently. As an RBT, you're usually providing direct one-on-one therapy, so you need to be self-motivated and attentive without constant supervision. But at the same time, everything we do ties back to a team goal, especially with the BCBA, the family, and sometimes teachers or other therapists. In my last role, I would meet weekly with my BCBA to review data and ask questions, and we'd adjust goals together based on what we saw in sessions. I really appreciated being able to contribute ideas and also learn from the clinical team. That said, during sessions, I had to make decisions in real time and stay calm on my own, especially during behaviors. I think the balance of working both independently and as part of a larger team is what makes this field really rewarding. Question number 7. What made you choose a career as a registered behavioral technician? Hiring managers want to know if you're truly passionate about the work or just looking for any job. RBT work can be emotionally demanding, so they're looking for people who understand the responsibility and find real meaning in supporting people with autism or behavioral needs. Your motivation says a lot about your long-term potential in the field. I chose to become an RBT because I've always wanted to work in a role where I could make a direct, meaningful impact. I first learned about ABA therapy while studying psychology in college, and I was immediately drawn to how structured and measurable it is while still being personal and hands-on. When I started volunteering with a center that served kids with developmental delays, I saw firsthand how much of a difference consistent, compassionate support could make, not just for the child, but for the whole family. That really stuck with me. Once I became certified, I realized how much I enjoy tracking progress, celebrating little wins, and being part of a team that truly wants the best for every client. It's not always easy, but I've never had a day where I didn't feel like the work mattered. That's what keeps me going. Question number 8. Can you describe a difficult moment or situation in a previous similar role, as well as how you handled it? Working as an RBT involves managing behaviors that can be challenging, emotionally draining, or even physically intense. This question helps hiring managers see how you react under stress, maintain professionalism, and follow behavior intervention plans. They want to be sure you can stay composed, think clearly, and act in the best interest of the client. One of the more difficult situations I've experienced involved a young client who was nonverbal and would engage in self-injurious behavior during transitions. One day, during a session switch from play to a table activity, the behavior escalated quickly and it caught me off guard. My first instinct was to react emotionally, but I reminded myself to stay calm and focused on the plan. I followed the behavior intervention plan step by step, using redirection, keeping the environment safe, and avoiding any reinforcement of the behavior. I also took notes on what happened right before the escalation, which helped the BCBA adjust the plan later. Afterward, I reflected on how I handled it and realized I could have given a clearer transition warning. So the next day, I tried a visual schedule with countdowns, and that helped a lot. These tough moments are never easy, but they teach me to be more prepared and patient and to always work with the team on improving the approach. Question number 9. Did you ever mentor anyone else regarding behavioral therapy? Even though RBTs don't supervise other staff, hiring managers want to see if you've been a team player and shared knowledge with others. This shows leadership potential, communication skills, and a willingness to support team learning. It also reflects how you contribute to a positive and collaborative work environment. Yes, in my last role, I helped onboard 2 new RBTs who were just starting out. While I wasn't in a formal leadership position, my supervisor asked me to be a go-to person for questions and support during their first few weeks. I made sure to walk them through how to log data accurately, use prompting strategies, and navigate the daily schedule. One of them was a bit unsure about how to implement extinction without feeling like they were ignoring the client, so I explained the reasoning behind it and modeled how to stay engaged in a supportive way. We'd also talk after sessions about what went well and what felt confusing. I always made sure they felt comfortable asking questions without judgment. I think it's important to lift each other up, especially in a field where everyone's learning all the time. Mentoring helped me grow too. It forced me to slow down and think through why I do what I do in sessions. Question number 10. Can you tell us about a mistake you made at a previous job and how you recovered from it. Hiring managers ask this to understand how you respond to challenges and whether you take responsibility for your actions. As an RBT, you're often working in sensitive situations where small missteps can affect a session or a client's progress. They want to know if you can learn from mistakes, adapt quickly, and communicate well with your team and supervisor. This question shows how you handle pressure and grow in the role. During my first few months as an RBT, I once forgot to reset a client's token board before a new session started. The session began with the child already frustrated because the board didn't match the usual routine. I could see that skipping that simple prep step threw things off for him. I paused the session briefly, calmly reset the board with him, and gave a quick visual reminder of the rules so we could restart on the right foot. After the session, I reported the mistake to my BCBA and wrote it up in my notes. We talked about the importance of session prep and small consistency cues, and I created a personal checklist I now use before every session. It wasn't a huge mistake, but it reminded me how much every detail matters in this work. Being honest about it helped me grow and avoid similar issues down the line. We're all human, but how we recover is what really counts. Question number 11. Why did you leave or do you want to leave your previous employer? This question helps hiring managers understand your professional values and whether you're leaving on good terms. They want to see that you're thoughtful about your career decisions and not jumping from job to job. For RBT roles, they also want to know that you're looking for growth, alignment with ABA practices, or stronger supervision, not just leaving because of burnout or conflict. I really appreciated the time I spent at my last clinic. I learned a lot about ABA, built strong relationships with families, and worked with a supportive team. But I started to feel like I'd reached a point where I wasn't growing as much. I was looking for more consistent supervision from a BCBA, more opportunities for training, and a team that really emphasizes collaboration and communication. My goal is to keep improving as an RBT so I can support clients in the best way possible. I'm also hoping to work somewhere that offers clearer paths to development, possibly even toward a BCBA track one day. So it's not about leaving something bad. It's about finding something that's a better fit for where I want to go. I care about this work, and I want to be part of a team that supports both the clients and each other. And finally, here are some common advanced and behavioral registered behavior technician assistant interview questions. Question number 1. How do you handle aggressive patients? This question helps employers assess your ability to stay calm, follow safety protocols, and protect both yourself and the client during high-stress situations. They're looking for someone who can de-escalate behavior while still showing empathy and understanding. It's also important that you know how to document and communicate incidents clearly. A thoughtful answer shows maturity, training, and emotional regulation. When I work with a client showing aggressive behavior, I always prioritize safety first for the client, myself, and anyone nearby. I follow the behavior intervention plan, use preventative strategies like redirection, and stay calm in both my tone and body language. If needed, I step back to give the client space and avoid escalating the behavior further. One situation that stands out was when a client began throwing items and shouting during a transition. I remained close enough to monitor but kept a calm, quiet voice and offered a preferred item as a distraction. That helped him settle, and we talked through what happened later during a calm moment. Afterwards, I documented the incident clearly and discussed it with the BCBA to see if we needed to adjust the plan. Aggression can be tough, but I remind myself it's often a way of communicating discomfort. My role is to respond with care, patience, and structure. Question number 2. What are some of your most often used therapeutic techniques? This question gives insight into how well you understand and apply evidence-based techniques as an RBT. Hiring managers want to know if you can stick to behavior plans and use appropriate interventions. It also shows your level of experience with day-to-day strategies in behavior therapy. A strong answer will highlight both technical understanding and flexibility with different clients. Some of the techniques I use most often include differential reinforcement, prompting, and shaping. I use positive reinforcement daily to increase target behaviors, like using communication cards or following simple instructions. I also rely on task analysis for teaching skills in small, manageable steps, especially for life skills like hand washing or brushing teeth. For example, with one client, I used forward chaining to teach how to put on shoes independently. We celebrated every small step, and it really helped build his confidence. I also use visual supports like schedules and token boards to help clients understand expectations and stay motivated. When I choose a technique, I always refer back to the behavior plan and consult the supervising BCBA. I've learned that consistency is key, but so is adjusting the delivery to fit the individual. What matters most is keeping the experience positive and achievable for the client while collecting accurate data so we can measure real progress. Question number 3. How do you proceed when there is a disagreement in the care team? This question tests your professionalism, communication skills, and ability to navigate collaboration in a healthcare setting. RBTs often work as part of a broader team that includes BCBAs, parents, and sometimes teachers or therapists. Employers want to know if you can handle conflict respectfully while staying focused on the client's goals. They're also checking if you know when to speak up and when to defer. If there's a disagreement on the care team, I always try to focus on the client's best interests and keep the conversation respectful. I start by listening and making sure I understand where everyone is coming from. If I feel something could impact the client's progress or safety, I bring it up to the supervising BCBA privately and share what I've observed. For example, I once noticed a parent was using a reward system at home that didn't line up with the behavior plan we had at the clinic. Instead of correcting them directly, I shared my observations with the BCBA, and they followed up with the family to clarify things and get everyone back on the same page. It's normal for people to have different opinions, but I always try to stay solution-focused. We're all here for the same reason, to help the client grow, and clear communication is what keeps everything working smoothly. Question number 4. How do you handle a situation when a patient's family is upset or frustrated? Families play a huge role in a client's success, and how you handle emotional or frustrated parents can affect the trust they have in your team. Hiring managers want to know if you stay professional, empathetic, and respectful, especially under pressure. This question also highlights your ability to communicate and refer concerns to the right person when needed. When a family is upset or frustrated, I do my best to listen first without interrupting. A lot of the time, they just want to feel heard. I stay calm and respectful, and if I don't have the authority to resolve the issue, I make sure to pass it along to the BCBA or supervisor quickly and clearly. There was a time when a parent felt their child wasn't progressing as quickly as expected. I explained what I could about the therapy process and that each child responds differently to interventions. I also let them know I would share their concerns with the BCBA so we could look at progress data together. They appreciated the honesty and follow-through, and we were able to adjust the program slightly based on updated assessments. I've learned that being patient, transparent, and responsive goes a long way in building trust with families. Question number 5. How do you explain complex medical terms or treatment techniques to patients? As an RBT, you may be asked to explain therapy methods or behavior goals to families or team members who aren't familiar with the clinical language. Hiring managers ask this to see if you can break down information in a way that's understandable, respectful, and accurate. It also shows your ability to connect with families and support open communication. I always try to keep things simple and relatable when explaining something complex. For example, if I'm talking to a parent about reinforcement schedules, I might say, "We're working on giving praise or rewards at the right time so your child knows exactly which behavior we want to see more of." I check in often to make sure I'm not using too much clinical jargon. If a parent looks confused or overwhelmed, I pause and ask, "Would it help if I explained that a different way?" I also like to use examples that relate to their daily routine, like brushing teeth, getting dressed, or sharing toys, because it makes the information feel more useful and familiar. I think it's important to keep communication honest and clear so parents feel empowered, not intimidated. When people feel comfortable asking questions, they become more involved, which helps the client make progress at home and in therapy. Question number 6. Can you describe a situation when the facility you were working in underwent major changes and explain how you adapted to them? Hiring managers want to know how you respond to change, especially in environments that serve vulnerable populations. As an RBT, routines can shift, protocols can be updated, or leadership may change. They're looking for flexibility, professionalism, and a positive mindset when things feel uncertain. Your answer shows how you stay grounded while still supporting your clients. A few years ago, the clinic I was working at transitioned to a new electronic data collection system, and at the same time, we had changes in staffing and caseloads. It was a lot to adjust to all at once, and I'll admit it was overwhelming at first. I gave myself time to learn the system by taking notes, attending every training offered, and asking for clarification when I needed it. To stay grounded, I focused on the kids. Their routines were still my priority, so I kept everything as smooth as possible for them. Behind the scenes, I stayed organized, double-checked my documentation, and supported coworkers who were also trying to figure it all out. I think what helped me adapt was staying calm and remembering that change is part of growth. Once I got the hang of the new system, I actually found it easier and more efficient. I came out of that experience more confident in handling transitions, and I always try to lead with patience when things shift. Question number 7. How do you handle a situation when you don't know the answer to a medical question? RBTs are often seen as trusted figures by families, but they aren't licensed medical providers. This question helps hiring managers evaluate your professionalism, your boundaries within scope of practice, and how you respond under pressure. They want to know that you prioritize safety, stay calm, and know when to escalate appropriately. If a parent or caregiver asks me a medical question that's outside my scope as an RBT, I always respond honestly and respectfully. I'll say something like, "That's a great question, but I want to make sure you get the most accurate information, so I'll refer you to our supervising BCBA or the client's doctor." I never try to guess, because even if my intention is good, it could lead to misinformation. There was a time when a parent asked if their child's medication might be affecting behavior. I told them I wasn't qualified to answer that and offered to pass the question to our BCBA, who could coordinate with the medical provider if needed. The parent appreciated the honesty, and it helped build trust. I've learned that it's okay to not have all the answers. What matters is being responsible and knowing how to guide people to the right place. I always focus on clear communication and protecting the client's well-being. Question number 8. Can you describe your expertise in skill acquisition and behavior reduction? This question helps hiring managers assess whether you understand core RBT responsibilities and how they show up in your daily work. They're looking for a strong grasp of ABA principles and how you apply them with consistency and compassion. It's also a chance to show how you balance structure with patience to support progress over time. In my role as an RBT, I've worked on both skill acquisition and behavior reduction goals daily. For skill acquisition, I use techniques like discrete trial training, natural environment teaching, and task chaining, depending on the client's goals and learning style. I stay consistent with data collection so I can track trends and know when it's time to move forward or adjust a target. For behavior reduction, I follow the behavior intervention plan closely and always focus on identifying the function of the behavior. I use proactive strategies to prevent escalation and reinforce replacement behaviors when the client is calm and regulated. I never just focus on stopping a behavior. I focus on helping the client learn what to do instead. One of my proudest moments was helping a child go from headbanging during transitions to using a visual schedule and requesting breaks. It took time and patience, but the data showed real progress and his family noticed the difference. I love being part of that kind of change. Question number 9. Can you tell us about a situation where you managed to successfully convince a reluctant patient that the prescribed treatment plan was the optimum solution? Hiring managers ask this to understand how you handle resistance, especially from clients who may not immediately see the benefit of behavior plans. It helps them see your communication style, how well you stick to evidence-based practices, and whether you show empathy and patience. Since RBTs often work with individuals who struggle with change, your ability to explain and encourage calmly is key. They're also looking to see if you collaborate with supervisors appropriately. One time, I worked with a teenage client who was frustrated by the idea of using a visual schedule during sessions. He felt it was for little kids and didn't want anything to do with it. Instead of pushing right away, I asked him to tell me what he didn't like about it. Once I understood his concerns, I explained that the schedule wasn't about age, it was about having control and knowing what to expect. I framed it as a tool that athletes and professionals use all the time: game plans, routines, checklists that helped shift his perspective. I also let him help design the visuals so it felt more like his own tool. After that, he was much more engaged and we saw an improvement in task completion and transitions. I think the key was slowing down, validating his feelings, and making the plan feel collaborative. Sticking to the principles of ABA while making space for the client's voice made all the difference. Question number 10. Did you ever have a time when you felt dissatisfied with your work as a behavioral technician? This question gives insight into how self-aware and reflective you are. Hiring managers know that RBT work can be emotionally challenging and progress may feel slow at times. They want to see that you care enough to want to do better and that you use dissatisfaction as motivation to improve rather than as a reason to disengage. It also shows whether you take initiative when things aren't going as planned. There was a time early on when I was working with a nonverbal child and I felt like I wasn't connecting with him the way I wanted to. I was following the program exactly, but I could tell he was frustrated and sessions weren't flowing well. I remember going home one day and just feeling like I wasn't doing enough. Instead of getting discouraged, I brought it up to my BCBA during supervision. We reviewed the data and looked at what might need adjusting. Together, we updated the reinforcement system and made some of the activities more engaging based on his interests. After those changes, things improved a lot. He started responding more consistently, and I felt more confident in my role. That experience reminded me that it's okay to feel stuck, but it's important to ask for help and stay open to change. I don't expect perfection, but I do want to keep learning and improving for the client's sake. And finally, here's the last question. Question number 11. What questions do you have for us? Hiring managers want to see if you're genuinely interested in the role and if you're thinking about long-term fit. They also want to know if you're curious about the support, supervision, and structure you'll have as an RBT. Good questions can show you're focused on quality of care, team dynamics, and your own growth, all important traits for this role. Yes, I do have a few questions. First, how often do RBTs here receive supervision, and what does that look like? Are there opportunities for feedback in real time or mostly through scheduled check-ins? Second, how do you support RBTs when they're working through a tough case or when a client's progress plateaus? I think having that kind of guidance makes a big difference in both client outcomes and how confident we feel in the field. Third, I'd love to know more about how your team encourages professional development. Do RBTs here have chances to learn new skills or grow into other roles over time, such as training others or moving into board-certified assistant behavior analyst BCABA paths? Last question, what do you love most about the company culture here? It's always helpful to hear what makes the work environment stand out from the perspective of someone on the inside. If you want to learn more on how to land jobs and reach your career goals, don't forget to hit that subscribe and bell notification button to get new videos every single week. Also, don't forget to hit that like button because that motivates me to keep doing what I do. Stay safe, keep smiling, and good luck.